Hi, welcome to week 7 video presentation. My name is Carol. My topic is GI bleeding, upper GI bleeding. A lot of patients coming into the hospital with presentation of vomiting blood or bloody stool, tardy stool, and dark stool. What is causing upper GI bleeding? It could be peptic ulcer, gastritis, gastric ulcer, inflammation, having stress, or using alcohol, cigarette, and NSAID. Symptoms of GI bleeding, the patient may have symptoms of weakness, looks pale, shortness of breath, having bleeding when they vomit, dark stool, syncope, having gastric or abdominal pain. Pathophysiology. Gastritis is an inflammatory disorder of gastric mucosa. It could be acute or chronic. The main reason of having gastritis are using NSAID alcohol, cigarette, or having H. pylori infection. So those are the main reason to the loss of mucosal active area. Those substance inhibits the prostaglandin, and that is the main substance to suppress inflammation and stimulate secretion of mucus. If we loss of that function, so it will raise the gastric pH level and causing overgrowth bacteria. Another main reason of having GI bleeding is peptic ulcer. So this is the ulcer of the stomach and duodenal. So the similar reason like having H. pylori infection, using NSAID and alcohol abuse are the main reason of having the disease because those substances elevate the exit secretion and increase the mucosal barrier's permeability to hydrogen ions. It decreases mass of parietal cells and as a result, limiting the mucosa's ability to secrete a protective layer of the mucus and causing ulcer and bleeding from the stomach. Usually, a doctor will start having asking the medical history during examination and obtaining a list of home medications. Diagnostic tests also includes orthostatic blood pressure, CBC, basic metabolic, hemoglobin count, liver function. Rectal exam, endoscopy, colonoscopy, or doing chest radiography and angiography. Lower GI bleeding. The bleeding is from the jejunum, ileum, colon, and rectum. Risk factors. The causes of lower GI bleeding are diverticulitis, gastrointestinal cancers, Crohn's disease, ulcerative colitis, C. diff, diarrhea, polyps, hemorrhoid. Pathophysiology of diverticulitis. It is very common in left colon, having diverticular form in the colon wall. The colonic mucosa herniates through the smooth muscle layers, and the hypertrophy and contraction increase the intraluminal pressure and degree of herniation. So when we look at the colonoscopy picture, we will see a lot of hole and sac on the colon wall, where those could be the source of lower GI bleeding. Diverticulitis may cause abscess, fistula, peritonitis, bleeding, and bowel obstruction. Pathophysiology. Hemorrhoids could be internal or external. It is caused by increased pressure within the lower abdominal wall. Abnormal swelling of anal cushions. When we are pushing really too hard when we go, the stretching of the suspensory muscle is the reason causing the hemorrhoid. Engorged and mucosa is easily traumatized and that could cause bleeding. Treatment of GI bleeding or blood transfusion. So in the hospital I work, a PET red blood cell could be ordered if the hemoglobin is less than 7, And also IV fluid is ordered. They can help to replace the blood loss amount. Proton, proton pump inhibitor could be ordered oral IV push or IV drip forms that can help to control the gastric secretion amount. Antibiotics is helpful to the H. pylori infection and ulcerative colitis. It is very important to stop using and set alcohol and smoking. H. pylori requires 10 to 14 days antibiotics. So usually the antibiotics are amoxicillin, tetracycline, and some antacid medication should be used too, like ranitidine and proton pump inhibitor. EGD could be a diagnostic procedure or a treatment. Treatment includes endoscopy, bending ligation, pneumatic balloon dilation, polyp resection, and biopsy. Colonoscopy can be using as a diagnostic test or treatment procedure. Through performing biopsy, polyp resection, diverticular bleeding, epinephrine injection, and clipping to help to stop the bleeding. I hope this is helpful for you to go over the GI bleeding pathophysiology again. Thank you very much for watching. Have a great day.